We now have Puneet Singh. Um, Puneet, yeah, thanks. I can see you now. I was just looking for where you were, whether your video was on or not. Thanks. So, Puneet is going to be talking about assessment and diagnostic experiences. Let me introduce Puneet to all of you. Puneet Singh is a disability inclusion advocate and an accessibility professional. He's a person with dyslexia, dysgraphia, and stammering. Dyspraxia. He's building a global network of young persons with disabilities and providing capacity building, educational, employment, and other resources to empower the community. Um, Thanks so much for taking your time off and agreeing to speak today. Over to you, Puneet.
Thank you so much, Chetan, for this opportunity, and uh, my regards to to all the listeners who have given us their time in the weekend. That is very kind of you. And when I'm a disability right activist, so like I talk about disability, I talk about our rights 24/7, and it's my job. And but still, like, this topic is somehow makes me very uncomfortable because of what experience and uh, what I have to go through while assessing myself, while try to diagnose myself, which is, I would say, which is a very basic right. Everyone has should have this thing, to know themselves better. And for like me, for like for around my teenage, I was all thinking that I'm the only one, like, who is going through all of these challenges, and that's scary, that there is no one else, and to whom to talk. So I think that made me very kind of, uh, I would say, curious, that I want to know more. I want to know people who are going through these challenges, and that has made me like uh, I I got a job, a very decent job. And for someone like me who have born in a slum with an abusive father, like, getting a good job, and that financial security was the best thing, was nothing best. But when I decided to go and pursue activism, to advocate for equal rights for people with disabilities, I think that was my purpose, that was my call. And still, like, I lot of people know me, lot of I receive lot of messages uh, from across the globe, from youngsters, from adults, from everyone, like, who has, like, who has got some courage, some kind of hope because of my activism on a global level. But then when I went to, like, when I decided that I want to have a diagnosis, and when then I went to the professional, uh, he asked me few details, and then he said uh, that you're doing so well in your life, why do you want to have this diagnosis, and what's the need? Like, he was unable, and let me tell you, he's a very well known professional in Delhi, like one of the best. So I'm getting to hear such such a thing from him. It take me aback. I was little shocked. And then and it is, let me tell you, it is no different from my mom, who used to always say that, that's, you're fine, and you, like, nothing's wrong with you. You just, you just do a little bit more hard work, focus more, and you will ultimately try to learn, like, you will be, like, you will be good. That's just kind of dismissive, but I know that is coming from a place of care, a place of love, and also what we have been conditioned through the society. that kind of we talk about ableism, we talk about uh, the uh, the discrimination, the exclusion, all of these things. But from my mom, like I can understand she's not like she's not aware, she's not sensitive about these issues, and she had been like listening to all these neighbors and relatives that I think there is like your son is like that, your son is like that. So all of these things have made her little unaware, like it's none of her fault. But when I hear all of these things from my professional who is doing like whose job is to actually assess people and diagnose people, that that was something uh, i I cannot process even yet. And because the process of diagnosis, as the my previous speaker was talking about, it's about it's about identifying yourself. It's about that love that you deserve, and which we like uh, we as disabled individuals forget sometimes. And we need to like keep reminding ourselves despite all of these incidents that is happening all around us. And and in India, like we have also like some religious and social things that is around disability. And and I was thinking that that maybe somewhere in the West things are good. But when I met people from the West, and we were talking about all of these challenges around diagnosis, around disclosure, and in the workplace, in the family, the whole point of having a caregiver, all of these things, like it's I would say whole our whole humankind is far behind. No one is doing a lot better. Maybe Europe and US have good compliances, have good laws in place. Still I see a lot of similar things happening around the world. And I think we need to talk more about it. We need to like normalize uh, talking about diagnosis, talking about the right to know and identify ourselves. uh, and the more we talk with, the more people will come out. And that's how we normalize things. Like that's how we we make people realize that it's okay. It's completely okay. And it's needless to say, but it's completely okay to have disabilities. But it's not so okay when you're denied the right to get diagnosed. So I think that's I would say uh, the whole uh, point behind me wanted to talk about diagnosis, because I think that's the first time I'm talking about this issue uh, uh, in my 3-4 years of activism. And I would say I would like to talk more about it. And if someone is like um, going through similar challenges, I think sharing is important. I think but we need to make sure that we have a safe space. We have people who are understanding, whom we can trust, whom like they are sensitive enough and sensible enough to actually empathize with the challenges that we go through uh, while while the process of getting diagnosed. And when Chetan was giving me like giving us the topics like to choose from, I think that I immediately like wanted to talk about assessment and diagnosis, because it's not well discussed. It's still kind of a taboo, even in what we call in the professional expert world. They're still taking it as in a medical a model of disability, that that we need to like fixed. And if we just don't, if we're doing well in our career, if we are doing well in our life, I think that's that should not that should not complement with your disability. But I think it's not true. We can live our lives. We can enjoy our lives with disability. Yeah, there must be more challenges, which we can work upon with the help of our civil societies, with the help of our society, with the help of governments, with all the educational institutions and big corporate, like wherever we are working, wherever we are studying. I think with their support, uh, things can be changed. And I would say, if we talk more and more, we will get out of this tokenism as well, because a lot of people, lot of organizations just give it a shot, give it one off kind of this the kind of event, that that we are doing this for inclusion, we are doing for this diversity, all of these things. But actually, when we make it inculcate in our daily lives, then also then only the real change will happen. So for that, we need to self advocate. It's not an easy thing. It's certainly very, very difficult. It took me a whole lot of self care. It took me a whole lot of uh, I would say realization that I'm not alone. And and if I'm advocating for self love, I'm also aware of the challenges. I'm also aware of what can happen wrong, like what can go wrong. And that we need to think about, that we need to think about as a society. And like this kind of platforms where we have a kind of assurance, a kind of safe space, and these kind of spaces are needed, so that people can talk freely about the emotional turmoil they go through. And especially like in the settings of hospitals and clinics, and all these professional settings, that even like they are not sensitized enough. And 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 that is problematic, like uh, uh, that makes us realize that we need to like look at the way how experts are being trained, being I think training would be a little, I do not use words like training, but how they are sensitized, how they look at us, how they look at us as patient, as someone who are who are in need to be fixed, or do they look at us as human beings? So I think that is very imperative. It's very obvious, and it's on our face, like it's need of the hour to self advocate, but with lot of precautions, with lot of do's and don'ts. And yeah, and with that note, I will please thank you so much for listening to me. Thank you so much for this opportunity to share my experience. Thank you so much. Over to you, Chetan. Thank you.
Thanks, Puneet. Thank you so much for sharing your experiences around diagnosis and assessments, and for also highlighting some of like the important points, really, about how self-diagnosis versus a clinical diagnosis, the importance of self-diagnosis and knowing oneself, and also the nuances that happen within the clinical space, like you mentioned, the hospital, the clinic, and how the professionals sort of rely more on a medical model, and where we need to really acknowledge the social model, look at it in a more humane approach than just the patients. And also, it was fascinating to see how you described self advocacy, really, also coming out of self care. I think we miss out on that self care aspect, and then that's so crucial to really know that. And also talking about the various intersectional factors of religion, culture, locations, different locations, social locations. So thanks so much, Puneet, for this. And yes, we also have some questions which we can take later on. We'll now proceed to the next speaker.